Hi, everyone. Welcome to Talk, Listen, and Share tonight. My name is Shay Moraga, founder and president of Shay's Warriors. Tonight, the information contained in this program is for general information purposes only. This program, known as Talk, Listen, and Share, is a product of Shay's Warriors Life After Cancer. While we endeavor to keep all of the information up to date and correct, we make no representations or warranties of any kind, express or implied, about the completeness, accuracy, and the reliability, suitability, or availability with respect to the information, products, services, etc., etc. I'm going to leave everything on the bottom of the screen, but that is the disclaimer for tonight. If you want to collab with Shay's Warriors, it's just Shay's Warriors at, it's www.shayswarriors.org. Shay's Warriors is a 501c3 nonprofit located in the Coachella Valley. We were formed because there's a little technical stuff going on my end. I apologize. But we were formed in the Coachella Valley for women in life after cancer, breast cancer, and other reproductive cancers. I'm going to turn it over to Rosemary now, who will start the show. Thanks for being here.
Hi, my name is Rosemary Flaherty, and I will be the moderator tonight for this topic, which is one of the most common problems that is experienced in survivorship from people who have gone through cancer treatment and have a fear of the recurrence of the cancer. So it is a very real problem. It is widely accepted as one of the unmet needs in survivorship. So the first Talk, Listen, Share of September was another topic that is common to survivors, and that is fatigue. And so that's the unmet physical demand of survivorship. And so tonight we're going to deal with this difficult and unmet problem of survivorship that's more in the psychological domain. So I would like to introduce a guest and a presenter who will be part of this presentation tonight. And Kathleen Lebansky is a board-certified geriatric nurse practitioner and a certified teacher of stress management techniques and mindfulness. And she works at a cancer center with clientele that has had cancer or is currently going through cancer treatment. And she also deals with clients that have chronic medical conditions. So the outline of tonight's presentation is that I will do a small introduction, and then essentially it's open to you as a forum to ask questions, to participate, to give your insight into your experience and share that with us. And then after that discussion and answering some questions, we're going to go and hand it over to Kathleen, who will conduct a mindfulness meditation and exercise so that you will be able to experience the benefits of that and be able to end this discussion with a nice, relaxing exercise. So as I mentioned, the fear of recurrence is a multidimensional problem. And these start presenting themselves actually during treatment. It's like the minute that you are diagnosed with cancer, that you hear that you have cancer, there's just a number of fears that start presenting themselves. And then as you go through treatments, you go through surgery, chemo, radiation, then there is the fear of, is this treatment working? What is my next step? What are the outcomes? What's my final pathology? So there's a lot of fear and uncertainty that is kind of developed the minute you hear that you have cancer. So it's a multidimensional problem that presents in treatment and survivorship. It's the fear, the worry, and the uncertainty that the cancer will return. It's normal, it's very real, and it can impact the quality of your life, of anyone's life who has experienced cancer. most commonly reported psychological problem. And it is complex, and it requires knowledge and skill, and a new approach that can help you build practices into your life, give you outlets so that you can share your experience and possibly get interventions from professionals along the way. This is more of an issue for the younger survivors. So it impacts life, role, future in a different way in younger survivors than it does in older survivors. It also is greatly amplified in people that have decreased education and access to healthcare. And those people that lack optimism in confronting their illness, in confronting their treatments, in entering into survivorship, also have a more difficult time with the fear of recurrence and the uncertainty. So levels of distress and pessimistic attitudes do affect how impactful this is on your life. What are things that can help? So there are a number, I'll go back and say that there are over 600 articles related to fear of recurrence that are published as research studies and as articles in the medical journals. So things that have been identified as being helpful to help reduce the fears, to help to learn to deal with the uncertainty and the anxiety, are mindfulness practices. It's also helpful if you learn your mindfulness practices from someone who is a trained instructor. It helps to increase objectivity, changes perspective, reduces anxiety and the fear. The other thing that helps is learning practices that help you deal with the uncertainty. So there are certain ways to help calm yourself down: internal self-talk, relaxation exercise, distraction from the things that, using distraction as a way to help when triggers cause this phenomena of the fear to be amplified. Because there, as people know, there are certain experiences that certainly amplify the fears. And people identify if someone close to them has been diagnosed with cancer, the upcoming medical appointments can certainly cause a lot of fear. The diagnostics and the scans that are involved that you experience a lot more frequently in survivorship than you did before you were diagnosed with cancer. So these are the situations that exercises and preparation can help reduce the anxieties and can help reduce those fears. Another strategy is learning to improve your communication with your healthcare professional. So it's important to be able to discuss with them what you're really experiencing. Are you having physical symptoms that are causing you great concern? Are you experiencing increased fears that you don't really know what to do with? And also talk to them in terms of how your mental health is. Are you very worried? Do you feel fearful? Are you having difficulty in the physical domain? Do you feel weak? Do you feel pain? Are there issues with your appetite? Insomnia, not being able to feel rested. So all of those issues that are common to fatigue, if they're coming in, and they can increase your fears. So it's important to learn how to really talk with your healthcare provider, because sometimes when you've been diagnosed and when you've gotten your pathology reports, it's difficult to absorb when they're saying your chances of recurrence are this percent. So it's important to know what exactly does that mean and to be able to ask, related to me, can you please explain how this is ascertained? How did you come to this information? And what does it relate to me? So those are important aspects to develop that relationship and to develop your own self-advocacy and communicating when you go to your physicians and your follow-up and your oncologist, to let them know that these are really the issues that are going on with me. And learning how to just overall handle stress. And one of the big helps in handling stress is going to a therapist to help you to adapt good practices to manage and adapt to the stress. Support groups that are run by social service workers, or support groups that have been recommended by your psychologist or your psychologist, whoever you choose to go to if the issue is getting out of hand and impacting your life. So the strategies to help with this, to improve the quality of your life so that this is something that doesn't take over relationships, workplace, returning to your role of mother, of wife, of sister, of daughter, of son. So the goal of tonight is to talk about it, discuss what you've experienced and the practices that have helped, and then have Kathleen lead us in the mindfulness so that way we can leave feeling empowered with hope and with feeling relaxed. So just want to ask all of you to share, what has your experience been with the fear of recurrence? How has it affected your life and your outlook and your quality of life?
I can speak for myself. It's greatly impacted my life. I look at everything differently, at relationships differently, just everything. It's really the thing that leads me in the morning and the last thing I think about at night. So it's always on my mind. And I've learned a lot about who is there for me and who's not there for me, quite frankly. So what I do to try to reduce the fears and the anxiety works a lot for me. Sometimes does, sometimes doesn't. As I will meditate in the mornings. I also see a therapist who's really good at helping me go through the anxiety of it all, and really, truly trying to have a better outlook on the rest of what my life will look like. Just being positive that it's not going to take me down the way, that sometimes somebody who's going through cancer, who has gone through a cancer treatment, thinks that it's going. So it is work, but through mindfulness, through some meditation, and through some therapy, it helps me get through every day. And I lean on my family and my friends tremendously. So for me, that's what I do.
Anyone else?
I think as I get a little bit farther away from where I was at diagnosis, sounds like there's a little background noise. Sorry, guys. There's three things that I've learned about fear of reoccurrence. Is fear is going to happen. It's a natural thing. And it happens to me on and off quite a bit. So I try to acknowledge the fear. I try to lean into the fear, I guess, a little bit. I know it sounds a little odd, but trying to lean into the fear and embrace it and acknowledge that it's there. Um, and then try to let it go versus avoiding it, because the more that I avoid the fear, the more fearful I become. And I also lean into my faith. I have a very strong faith. So I always say, like, there's a saying out there, faith over fear. Or I reach out to friends and I ask them to give me some of their knowledge, their love, their support, their hugs, and I let them know what it is. And like Eileen, you know who's there for you and who's not. And that's a big one, because there are tools, and our tools are our family, our friends, and acknowledging fear, because fear is a natural state.
How do you lean into your fear?
For me personally, I meditate. I do my yoga. I sometimes, I know this is going to sound really strange, but I did this when I was going to lose my hair as well. And I go to the mirror and I look at my reflection in the mirror. And it's almost like, I can't remember, it was like a Disney movie as a kid. Maybe it was like Alice in Wonderland or something. The girl looks at the mirror and then she reaches in through the mirror and she goes into this alternate world. So when I look at myself in the mirror, I think this is the normal Shay, and this is that Shay, and then I'm looking in the mirror and that's the strong Shay, that's the warrior Shay, like, and I'm going into that alternate world. I know it sounds really kind of kiddish, but it helps me to be able to, like, okay, I'm not going to be fearful. I am going to be faithful. And I know that this is just a temporary thing right now. So that's kind of how I've dealt with it on and off over the years.
Would anyone else like?
Some of the things that I've learned in my therapy is that, one of the things that I've been taught is to stop and say, is it true? Because, you can feel it and you can feel the fear, but at some point you really have to think objectively and decide, is it true? And for me, it's looking at it and saying, okay, well, is this true? Well, it might not be true today. So if it's not true today, it might not be true tomorrow. And so that's how I can kind of flip it on its end and say the fear, while I feel it, may not always be a true state. So it's almost sort of reprogramming my thinking by stopping and acknowledging that, yes, it exists, but it doesn't necessarily mean that it's true. I don't know if that makes sense, but that has helped. That is one of the tools that I learned during therapy to get all of this.
It's practices that help you get control over the thoughts,
right?
So that they don't completely take over and consume. So the practices that help you, like you said, identify reality, identify this moment as I'm fine right now. And those do so much in difficult situations. And then many times they're accompanied by those soothing, relaxing breaths that just, it kind of shifts the energy in the room by just taking a deep breath to allow yourself to feel the reality of you and your breath and the results that it gets. So those practices that you can just do quickly, immediately, and allow yourself to take over with your own life. That's the way that you can get through and move forward. Did you have, when we talked about resilience, it was the way that you become a more resilient person is if in your life you're forming habits that are helpful to you to build a good positive outlet, to develop presence, to have good exercise routines that you rely on to help clear your mind and make you feel strong and healthy. So it's throughout this cancer process, from diagnosis, developing those habits early on is really helpful in guiding the direction of your survivorship in dealing with the fears and the uncertainties. So all of the same practices that really kind of help you through fatigue, building resilience, are universal practices that can help with assuaging fears, moving towards positivity and optimism, and helping reduce the anxiety. Are there any questions from the audience, Shay? Are there any comments?
Not yet, there aren't. But we definitely are taking questions. We had a chance to introduce Christy.
So one of our guests tonight is Christy Hibbert, and she is a breast cancer. She is a clinical psychologist, a best-selling author and speaker, and a breast cancer warrior. She was diagnosed stage 1 triple-negative breast cancer with the BRCA1 genetic mutation in July of 2019. She fought through 13 surgeries, chemotherapy, cold capping, blood clots, kidney stones, and breast implant illness, starting her reconstruction over with a deep flat that started in September 2020. She has shared her real and raw journey, still ongoing, with lymphedema, gastroparesis, PTSD, and a wrecked core from a massive strangulated hernia. She's documented these on social media and in her award-winning blog and website, emphasizing the importance of emotional support for all cancer warriors is her mission. She started Growing Through Breast Cancer, she started Growing Through Breast Cancer, which is the Facebook page and a monthly virtual emotional support group to help meet this need. She's a mother of 6 and was named Mother of the Year in Arizona in 2018. Now that is quite an introduction, Christy.
Thank you. I'm glad to be here.
Quite an experience and quite an introduction.
Yeah. It's been quite a journey.
That's a very long, a long distant journey in a relatively short period of time.
It's been just over 2 years and it's still going, you know, and it was stage 1. So I thought it would be a few months and I'd be done, but it's like everything that could go wrong has gone wrong. And yeah, so I'm still going at it.
How are you feeling right now?
I am very tired. As you said, fatigue is one of the number one issues, and that is an issue for me too. I'm dealing with a lot of things. I call it breast cancer treatment. But you know, I say I'm cancer free, but I'm not free of cancer. Kind of sums it up.
Yeah. That's like I have cancer, but cancer doesn't have me. That was one of the American Cancer Society's little advertising mottos quite a few years back.
I like that.
And one of my girlfriends was going through a very long course of cancer, and that was her favorite mantra to say at the time. It's like, I have cancer, but it doesn't have me.
Mm-hmm. I like it.
So how have you managed the fears and the anxieties and the stress of going through a very long journey with cancer, with many unexpected occurrences that happen?
Mm-hmm. Well, I mean, I have a leg up because I am a psychologist, so I have a lot. I do have a big emotional toolbox, as I would call it. You know, I'm the one that's usually teaching others how to use that emotional toolbox and what tools they need to have in there. So that's been a blessing for me to be able to use that. And I knew right away that I needed to be in therapy. So I have been seeing a trauma-informed therapist. And I will tell anybody out there who's either looking for a therapist, or if you're with somebody and you don't feel like it's the right fit, look for someone that has a trauma history or who is trauma-informed, because I think we really minimize the trauma aspect of all this. And this is why we have the fear, and why the fear is so real and so prevalent, because every single aspect, from diagnosis to chemotherapy to surgery to everything, even if I would have had that quote easier route of just the 3 surgeries I thought I was going to have and no chemotherapy like I thought I was going to have, it's still traumatic. It's still traumatic having that diagnosis, hearing those words, you have cancer. It's still traumatic having, you know, what I had a double mastectomy, like double amputation, you know, and it's no easy thing, the things that we go through. Chemotherapy is no joke. I really feel like the whole purpose of chemotherapy is to break you down to nothing. And it's not just breaking your body down to nothing, but it's breaking you down emotionally to nothing. It's breaking your identity down to nothing. And I feel like after a year and a half for me, my 13th surgery was, it was a year and a half in, and that was, quote, when I was told I was done. And I felt like I'd been on this sort of conveyor belt from doctor to doctor and surgery to surgery and thing to thing. And then all of a sudden the doctors were kind of like, all right, you're done. Congratulations. Good job. And they just dumped me out in, it's like the conveyor belt ended in the Sahara Desert. And I'm looking around and going, where'd everybody go? And what just happened to me, you know? And that's when I really started to realize that I had been traumatized. Like every single thing was pretty much a trauma. And it really made me feel like I said, I think I said it during chemo, that I felt like I was broken down to just like from a house to just the boards and the nails. But I felt like after I was, quote, done, especially because they say you're done and then you're not really done. I felt like I was like a dirt lot, you know, just, I don't know who I am anymore. I don't know what I need to do. I don't know who to turn to. I had to ask for physical therapy for my abs, that I was told I have no more abdominals after my massive hernia. And yet my doctor didn't even send me to physical therapy or occupational therapy for the lymphedema. You know, it's such a crazy journey. And I realized that what I had come out with was sort of an identity crisis, you know, which we have those throughout life. That's kind of one of my specialties as a psychologist, is self-worth and identity, and like, who are we and how that changes over life and everything. But also the trauma leaving you with post-traumatic stress disorder, which I learned since then that about 80% of breast cancer warriors end up with PTSD. And that is no joke. And it is real, and it is scary. And even if you don't have major depression, which is also very high rates, or even if you're not grieving, which is a huge part of the emotional aspect of all this, even if you don't have PTSD, you're still feeling a lot of emotions. You're still going to be anxious. You're still going to be afraid when you have to go back and have something come up. Yesterday I went to my oncologist and it was scary, and I made a little video about it. And I think that's why Shay invited me to come on, because I was just trying to be real about, you have this space that I call my breast cancer warrior persona that I put on. And, I was in chemo and a cape on my Facebook profile picture, but really you're just doing that because you're trying to cope. You're trying to put on the brave face and go do the hardest thing you feel like you've ever had to do, and go through horror after horror after horror. And somehow we're supposed to be just fine about that and okay with that. And what I feel like is just there's such a neglect of talking about these issues. I'm really glad you guys are talking about this, because the emotional support aspect is huge. I think most women have told me that they feel like that's been way harder, the emotional side of things, than the physical side. And there's a lot we can do to deal with those emotions, and some of those things have been discussed here, and I have some other ideas too. But I think it's really just important to be able to talk about them in a safe space where you're not going to be told, don't say that you're scared, don't say that you think you could die, don't say that. And someone said that in a comment to me yesterday, and I kind of went on a little rampage and made another video in response about it. Like, don't tell me what to feel, and don't tell me not to say how I'm feeling, because this is real. And I think when we tell each other not to feel something or not to say it, we're dismissing, not only we're dismissing them, yes, but we're also preventing healing. Healing can only come as we talk about it and as we really deal with it.
There's a great deal of importance in doing what you just did. It is revealing that raw side, because so much, there's that programming that we don't reveal these things to our, we can't talk to our kids about it. We can't talk to this person about it. I can't talk to that person. The importance of these groups is that there is a freedom to really talk about what is down deep inside and what has affected you and how your life has changed, and how important it is to acknowledge, as you said, so that there can be those steps towards feeling complete again, those steps towards feeling optimistic about the future, to feeling healthier again. Someone that's gone through the experience that you have, Christine, is you're still dealing with so many physical, your body needs restoration physically because of so many frequent insults to your health. The surgery, the repeat surgery, the cancer, the chemotherapy, and then the other issues that just consume a great deal of energy. And when you're feeling physically so depleted, it's really hard to nourish your feelings and your emotions. So it's just that those words that you hear is the importance of your self-care, what you can do for yourself, because it's just not many times the amount of intervention from the healthcare community to start those steps of nourishing you or assessing you, or like you said, you had to talk to your physician about getting physical therapy when you knew you needed to build up muscles and in order to get your strength back. So it's a difficult process, because the healthcare community, you can never get an immediate answer. There's always, because none can be provided, there's that uncertainty that starts there, right, with the communications. So it's not like you can go into surgery and it's what everybody says, 100%, this is going to be gone, 100%, everything's going to be perfect. You can never hear that. Yeah. So it's difficult, because that's what you want to hear. That's what we want to hear. Everything's going to be okay. And there's so many bumps along the way, so many possibilities of things that can happen, that you can only be prepared for. This can happen. We don't know how this is going to turn out. We just have to wait and see, which is very difficult to deal with.
I completely agree. And it is tricky because we do have to rely on our medical community and our providers, and hopefully everybody out there has really great providers, but we have to rely on them for a lot of things. But you're right, like we can't make that our sole place of being heard. I mean, just basic things that are so important. I know to any of you listening out there right now, just I feel like being seen, that if I put on makeup, I look fine. But earlier today I had my makeup off. I'm exhausted. Like you said, it's called, for everybody out there, it's called iatrogenic trauma. That is trauma that happens to your body because of medical procedures and things you've been through. So your body experiences literal iatrogenic trauma, and then your mind and your heart and everything in your spirit experiences the trauma of it all too, in a whole different way. So you're right, there's so much we have to do, and we can't, unfortunately. I wish that it was as easy as, oh, go to your doctor and get a prescription or whatever. And yes, I am on prescription medication because I could not do this without an antidepressant. So I just want to put that out there too. And I need a sleeping pill. I cannot sleep without it. But we have to be the ones to reach out and find that support. And I just want to kind of put a plug here, because that's why I started a support group, because it's the one place where all of us feel like at least once a month we can go and say how we feel, and we don't have to filter, and we don't have to, pretend that we're fine for our family, because, I have 6 kids. So I've been there. I understand that need to, like, oh yeah, everything's going to be fine. I'm fine. Everything's fine. And really inside you're going, I'm so not fine. And that's the one place where other people like this group, where other women just get it. You don't have to explain, and you feel seen, you feel heard, you feel understood. I feel like those are the 3 things that we just really want. And it's very lonely. It's a very lonely experience. I know many of you out there are feeling that too. I feel like outside of experiences like this, I feel like I'm kind of avoiding people a lot of the time, because I don't want someone to come up and be like, oh, how did all that go with that cancer stuff, And it's like, well, where do I begin? It's not done yet. I'm not finished. Or you look better, so you must be better. Well, no, that's not how it works, So anyway, we have to be in charge. We have to take charge of our emotional healing and be willing to call the therapist, go to the doctor and say, I think I need a medication for something. I also want to say, I have had pretty severe PTSD because of all this, and I also have a pretty significant trauma past as well. In fact, I became a mom of 6 because my sister and brother-in-law both died within 2 months of each other, and we inherited their 2 children right when I was going to give birth to what was going to be our 4th, but ended up becoming our 6th child. So I had 3 kids. I was pregnant. We suddenly inherited 2. I got, we had another baby, and boom, I was a mom of 6. And so I understand trauma healing and PTSD. And I have been doing ketamine therapy, which I never thought I would do. So I am doing 6 sessions of ketamine infusions, and it's for complex PTSD. So, we have to be willing to go and try the different types of treatments as well. I know earlier you had mentioned something about like cognitive behavioral therapy, and that's something that, I teach everybody, and I have on my website even some resources for that. I'm even going to be doing a webinar in October about that, because that can be so helpful. So if we aren't willing to like reach out, and we hate it because we really want it to kind of like come to us. We want people to understand and come to us and just be there for us and see us and understand us. But a lot of the time it's really just like trying again and again and again and again to find the thing that really is going to help put your fear at bay, help calm your anxiety, help with your worries, help with your trauma, all of that.
I think that there's an important point that you hit on, and it's that a couple of points. It's the one time in your life when you really need everybody to just be able to say, and then you'll go here, and this will help you, and then you'll go there. It's kind of like being able to just direct you down a beautiful, magical path of all kinds of assistance that's laid out for you. But you learn that you have to find so many things yourself. And then the other important side of that is that you're able to evaluate whether this is working. So you have to learn a lot about yourself. You have to be able to advocate for yourself in the medical community, and you have to be able to advocate yourself as to what's helping you. Because it's not good to waste your time and to be able to say, I don't think this is helping me at all. I don't want to come. You know, it's kind of a drag. I don't see the benefit. But it takes a lot to say, that's it. I'm not going to try this anymore. I'm going to find something else and then go on that journey. So you brought up so many very important points about the extreme trauma that's involved with the treatments for cancer. Very difficult.
Thank you. I agree with what you said here completely.
So we're going to, it's 6:15, so I'd like to turn this over to Kathleen, but I just want to ask one question. Does anyone else have something that they would like to add or like to contribute? I know that you came on a little bit late, Angela. Did you have anything that you wanted to share?
Well, I've been trying to get on this website or stuff, and you guys keep going back and forth. I don't really know what is being said.
Oh, okay.
But yes, as a cancer survivor and for 5 years, when people talk to me, or if I mention anything about cancer, just like Christine here, they're like, "Oh, you had cancer?" I said, "Oh yeah, 5 years ago, and I'm doing well. I'm in remission." But they're like, "Well, you look great," and I said, "Oh well, thank you. I feel pretty good. I feel like I'm doing well." But you know, when you get those little symptoms that you had prior to being diagnosed, like mindless fatigue. And I was like, why am I so tired? I mean, I'd be driving my car and like, oh, I could just fall asleep right now. So that was like my main symptom for being, you know, before I got diagnosed. So when any of the time that I'm, you know, in my car and driving with, and I get any sign of like, oh gosh, I'm kind of feeling tired, I go, oh, is this happening? And that last time I went in to see the doctor because I had a follow-up, and I just had a CT scan. Knew that everything, yeah, fatigue is one of the things that will stay with you for. And oops, just gonna put the picture now.
Angela, we're having some trouble understanding you
that
in and out of your experience.
Well, I think we've lost Angela. So I know sometimes the bandwidth in different areas does make a huge difference. We do have a few questions. Jason says, what is the one thing that scares you more than the fear of reoccurrence? And that's I guess that would be to you and I, Christy.
Good question. I mean, I think what scares me more than the fear of recurrence, honestly, this is probably going to sound cheesy, but is not being changed through this in some positive way. Honestly, like my biggest fear is that I'm going to die and leave my children when they've already lost a mother, and a couple of other my friends that were their second mothers also died, and so that's been a big fear of mine. But I really, like, besides that, I think my biggest fear is just I don't want to go through all this and not be better in some way. And it's sometimes, because sometimes you feel bitter and not better, you know. So I'm always working on that. That's one thing that does scare me, honestly.
I think for me, is having to go through it all over again. Just how much I fought the first time to get to where I'm at today, how much work I've gone through and continue to go through. I mean, it never goes away. And like you being in a information or support group, it helps to have other women understand what we've gone through, because another fear is the fact that when someone does ask me how I am, or I'm talking to other friends and they really want to know how you are, and maybe today is a bad day for me, and I tell them, they don't really want to hear that, right? And that's a different type of fear as well. This is very hard to explain, waking up in the morning and saying, it takes me an hour to wake up and get my joints to get back together. And because of all the therapy I've done, or all the treatments that I've done, like I did all of that to live. And it's not a fight to live every day, but it's sometimes a fight and a struggle to live in my mind every day. So I don't want to go through that again. And that's why I go to a therapist. That's why sometimes I need a little bit of medication. That's why I do the yoga, I do the breathing, the meditation. Like I try to do it all, or I reach out to friends or doctor friends that understand. Yeah, it's not all in my head. This is something that we knew would be a long marathon. So.
And I just want to add too, because I wasn't thinking before, but for anybody who carries a BRCA gene, that my kids are going to get it. One of my sons has the BRCA gene right now that we know, and my 2 daughters haven't been tested yet because they're just barely getting old enough. But that's another huge one too, that you pass it on, and then your grandchildren, and it goes on forever. So it's a big deal. Yeah.
We have a couple more questions, and I know you want to get to our closing ceremony, which is amazing. Actually, this is just thank you, Dr. Hibbert. You touched on all my issues. PTSD for the second time in my life. It was healing to hear your voice and thoughts so eloquently. Debbie also says, wow, you have said things I needed to hear. Thank you. Nathan says, feeling alone in this journey must be very difficult. You are not alone with Shay's Warriors. And Cheryl says, so many things have been said that I am in tears. I'm not doing well for the last 6 months, and I've had so many scans, tests, and procedures with biopsies that I'm so afraid of what's to come. Shay, you're speaking my language, and I feel I'm on my own. You're definitely not on your own, Cheryl. Not at all. We're here with you. Thank you for your responses. You are warriors. You guys are going to have me crying in tears tonight. We need this meditation, Kathleen.
Yeah. Thank you so much for all of your comments, Kathleen.
Well, welcome. It was difficult and inspiring to hear our lecturers and the people giving from their heart about their personal experiences. And I'm sure it's raised a lot of stress, adrenaline, anxiety, and the stress response. And what I'm hoping to do is to help share with you some activities or practices that can stop or reduce the stress response, and to help share the benefits of the parasympathetic nervous system coming into play, which basically allows you to rest, relax, and restore through the breath. It's a conscious awareness of the breath that will allow the body to decompress, de-accelerate from the stress response. So let's begin. I like to share with the group, there's a few physical exercises one can do sitting in the chair, and they can include isometric exercises. So after hearing this discussion, I'm sure your arousal state has been ignited in terms of the heart beating fast, your breathing feeling fast, your pulse rate accelerated. So we're going to do some isometric exercises to begin with to help release some tension and some knots that might have accumulated by the listening of the information. So let's begin. First, we're going to start with the feet. I want you to curl your toes and hold them for 3. 1, 2, 3. Relax. Coming up to the buttocks, tighten or squeeze those buns. 1, 2, 3, and relax. Your hands, hold them, make a tight fist and hold them for 3. 1, 2, 3. Open and relax. And lastly, make a funny face, scrunch that face, hold it for 3. 1, 2, 3, and relax and smile. So hopefully that already has helped you feel a little less stress. Now we're going to go into a breathing practice. It's called measured breathing. I'm going to count. It's a 4-4-4 practice. This helps you to self-regulate what's going on in the atmosphere or the environment. Again, coming back to the breath, it can bring you back to your center and your stillness and your calm. So we'll do this for 3 times, 3 repetitions. So we're going to breathe in on the count of 3, hold for the count of 3, and then exhale for the count of 3. So let's begin. Breathe in, 2, 3, 4. Hold, 2, 3, 4. Exhale, relax, 2, 3, 4. Breathe in through the nose, 2, 3, 4. Hold, 2, 3, 4. Let go, release, relax, 2, 3, 4. Last time, slowly breathing that air in through the nostrils, 2, 3, 4. Hold, 2, 3, 4. Let go and relax, 2, 3, 4. So in this measured breath, the holding and releasing or the exhale are allowing the parasympathetic nervous system to be present and to do its job, to help you to rest and relax. Now, another practice in mindfulness, aside from living in the now, in the present moment, breathing in the present moment, eating in the present moment, is being compassionate to yourselves. So I invite you to gently bring your hands across your heart, crossing your hands in the heart center. You can close your eyes, and you're slowly going to breathe in, calm, and you can say the word silently to yourselves, I am breathing in calm, or just simply saying calm. And then on the slow exhale, peace. So we're savoring the in-breath, savoring that pure puff of clear, pure air coming into the base of the nostrils, being warmed by the nasal cavity, and you're simply saying, as you're drawing that to you, calm. I feel calm. And then on the exhale, relaxing, and I'm peace. And you can allow the peace to accentuate outward. Peace. One more time, breathing in calm. Slowly exhaling, peace. Now you can relax. Another reason why we put the hands over the heart is really to give you some self-care, some self-love, some gratitude and compassion for what you've been going through and what you're going through, the worries, the concerns, to alleviate that a little bit for living in the now, right in this moment, this beautiful, precious moment that we all have. Now we're going to digress to a modified body scan. So closing your eyes, I invite you to envision a color about 6 inches above your head. You select the color that you'd like to be bathed with. Now that you have that beautiful color, imagine that a light source has been turned on and you're going to start to feel the rays of the heat of this beautiful color penetrating the tiny muscles of your scalp. Yes, the rays of this color are infusing health, relaxation, peace into the hair follicles of your scalp, starting in a clockwise fashion around your hairline, behind your right ear, down back of your neck, gently coming up the left of your ear and back to the 12 o'clock position. And now with the next inhalation, allowing that beautiful colored light to flow across your forehead, loosening up the tension, the tightness of that muscle of the forehead, relaxing the muscles around your eyes, and that beautiful healing color is penetrating your facial cheeks, upper lip, lower lip, and loosening up the tension of your jaw as you're breathing in and slowly, effortlessly breathing out. Again, mindfulness is coming back with awareness, focus, and concentration. You are being present at this very moment. You're not sleeping, you're not napping, you're paying attention to the breath as you're breathing in and slowly breathing out. And now envision that beautiful colored healing light spreading down through your entire body as if you were receiving an infusion of this healing, peaceful, calming colored light throughout your body, neck, upper back, lower back, chest, symmetrically down the shoulders, into the elbows, out through the forearms, flowing into the hands as you're breathing in and slowly breathing out. Again, this beautiful healing color is extending down into your entire body, down into your legs, knees, lower legs, and feet. And now, if you can imagine allowing that beautiful healing color to dissipate and go through your soles of your feet and meeting the mineral kingdom of the crust of the earth. And now granting with permission that beautiful healing energy of Mother Earth coming up through the soles of your feet, feeling, sensing this wonderful strength and courage you're drawing from Mother Earth through your feet, up your legs, and back up into the heart center. So now we are blending and merging from the heavens above, that you brought in that healing color of energy and that beautiful source energy from Mother Earth from down below. The two are mixing and blending in the heart and circulating and easily dissipating, helping all the cells, all the muscles, and all the bones to relax, restore, and be at ease as you're breathing in and slowly, effortlessly breathing out. Whatever words, thoughts, or sensations that come to mind, just allow a beautiful fluffy cloud to pass through and try to bring yourselves back to center as you're breathing in calm, exhaling peace. So again, my invitation to everyone is that when you're feeling anxious or fearful, to come back to the breath. Sometimes I bring out a container of bubbles and I will blow into the instrument that the bubbles hold and create bubbles and see the beautiful bubbles out in the environment. And then I will envision that I am drawing to me one of those translucent, colorful bubbles to my nose. And I'm sensing and I'm wondering that experience to my nose, through the nasal cavity, flowing easily down the throat, into the lungs, exchanging carbon dioxide and up, back, out, through. And perhaps you can gather another bubble. So what this does, it brings you back down to the here and the now, back within your body. Instead of being concerned about what if, you have the beauty, the tranquility of breathing with yourselves, self-regulating through the breath, through the body scan, or imagining yourselves in a place in nature. Wherever nature calls you, see yourselves there. Envision yourselves as if you were there right now, sensing the beautiful colors, hearing the sounds of nature, whether it be the wind, the birds, or whatever. Tasting, maybe you're at the seashore and you can taste the salty sea breeze. And then what are you wearing on your feet? The tactile stimulation. Oh, it's all so wonderful. Just like the commercial says, for a moment, Calgon, take me away. Break that intensity of the anxiety. Bring me down, center, and focus. Thank you very much.
Thank you, Christine. That was a great way to end this difficult conversation that reflects the reality of the cancer experience. So it's a tough topic, but there are many ways to start approaching it, to decrease it and allow yourself to feel less fear and less anxiety and less uncertainty. So what I think that we will do is end this tonight while talking about what's going to be happening next month. So next month is October, and as you're probably all aware, it is the month that we are recognizing breast cancer and promoting healthy practices and promoting awareness and promoting the value of mammograms and breast self-exam, and celebrating the people who have gone through this and learning from each other and promoting, making everyone aware of breast cancer. So it's a big month for Shay's Warriors. And the next Talk, Listen, Share is going to be on the 13th of October. And the topic is going to be a reflection and a review of Shay's Warriors as an organization. So it's going to be talking with Shay, who will be presenting essentially what the mission is, what has been accomplished since the start of this very young organization, and who it's affected. And it will be a wonderful, uplifting discussion about a very important group of people that have come together and dealt with the lackings that they were feeling in their survivorship by providing a platform for them, talking with each other, and in a place that feels safe. So, and promoting that wonderful mind-body connection. So with this, I will end this session of Talk, Listen, Share, and hope that you come back next month, and hope that you have a wonderful evening tonight. Can't hear you. You're muted.
Thank you, everyone. Have a wonderful evening. Thank you, Kathleen. Thank you, Christy, Dr. Fang, and Rosemary. Thank you.
Thank you so much. Thank you so much for being here.
Good night.
Good night.